Quad muscle group. Sartorius muscle. Quad tendon. Patella. Patellar tendon. Tibial tuberosity. Lateral meniscus and joint line. Fibular head. Lateral collateral ligament. Popliteal tendon. Biceps femoris tendon. IT band. Gerdy's tubercle. Medial meniscus and joint line. Medial femoral condyle. Medial tibial plateau. Medial collateral ligament. Pes anterine tendon and bursa. Sembitendinosus tendon. Gracilis muscle. Hamstring group. Popliteal fossa. And heads of gastrocnemius muscle.
Okay, now active range of motion. Flexion. Can you bring your heel up to your butt? Okay. And then. Okay, you bring your heel up to your butt. Okay, this is supposed to be 135 to 145. Bring it back down. Yeah, push down. Okay. Okay, push down. Okay, this is supposed to be 0 to 10. Now, passive range of motion, we're going to do the same thing, but I'm going to do all of it. Okay. Okay. Manual muscle test. We'll start with extension. Okay, push out. Okay. And now we're gonna go to flexion, flip over. Start with normal position, push against me. Okay. Then internal rotation, push against me. External rotation, again. Okay. And all those test different muscles. Now we are going to do special tests. Start out with the sweep test. That checks for swelling in the knee. Bilateral. You're going to press down and see the patella come up. That is for fluid in the knee if it looks like there's a floating patella. Noble's compression. Put pressure over here where the IT band is and just flex and extend the knee. That is checking for IT band syndrome. Then Godfrey's 90-90. See if there's a little sag right here. That would be damage to the PCL. Posterior drawer. Push in. See if there's damage to the PCL, if there's laxity. And then anterior door is pulling anteriorly. That is to check if there's damage to the ACL. Lockman's. Going to kind of alternate your hand movement. That is also checking for ACL. The valgus stress test. Push lateral or push on it laterally. That is checking for the MCL. Also check it with the knee flex about 25 degrees. Still that checks the MCL too. Varus, same thing, but checks the LCL. Flex 25. Checks the LCL also. Lateral pivot shift. You're going to internally rotate and put valgus pressure. See if it's damage to the ACL and LCL. Slocum drawer, internally rotate, You're gonna pull anteriorly, and that's checking for ACL and LCL. Exterior, same thing, checks for ACL and MCL. And then Houston's internal, you're pushing in, that checks the PCL and MCL. Externally, same thing, that checks the PCL and LCL. Then Thessaly's gonna have you stand up and stand on one foot, kind of squat down and rotate. Okay, that checks for if there's pain, that's meniscus tear. McMurray's, you're going to internally rotate and come up, and externally rotate, same thing. And that also checks for meniscal tear. And then Apley's compression and distraction, I'm going to flip over. Bring up to 90. I'm going to push down. And if there's pain with that, and then pull up. If the pain eases and releases, there's a meniscal tear there. So now dermatomes. You have L1 starts up top, runs lateral to medial. That is hip flexion. L2, same thing, just a little lower, lateral to medial, is also hip flexion. L3, lateral to medial down towards the knee, that is knee extension. L4 comes down across up to the toe, or the inside there, and that is ankle dorsiflexion. L5 runs down in between the first and second metatarsal, that is great toe extension. S1 over here runs down there, and that is ankle plantar flexion. S2 goes behind the knee, and that is knee flexion. So now we'll do the reflexes. Can you come down here? Going to do the knee. Beautiful. And then the ankle, Achilles.